Good day, Sir Michael Algozo. We are the Group 3 and we will be presenting a case analysis about Bernard Soulier syndrome. So for our table of content, we have the patient history, test ordered, test result values, and correlation and analysis. So for the patient history, she is a 20 years old female reported to emergency room for a continuous bleeding after a dental procedure. She has no travel history, no medication taken, and she also said that her monthly period is heavy and as well as having a epistaxis. Upon physical examination, her body is covered in petechia and bruises, and she discloses a family history of thrombocytopenia. So for the symptoms, she has a epistaxis, severe bleeding in the nose, petechia, a red spot in her skin, and bruises or hematoma.
So for the platelet count, the purpose of this test is to determine the number of platelets in your blood and if someone has an adequate number of platelets or whether they have too few platelets called thrombocytopenia or too many platelets called thrombocytosis. So the principle of this test is the counting of platelets, which are microscopic cells that are smaller than RBC and aid in blood clotting. So the result of the platelet counts of the patients is 41,000 per microliter and interpreted as markedly decreased. So for APTT test, the purpose of this test, it measures the number of seconds it takes for a clot to form in a sample of blood after substances or agents are added. So the principle of this test is can be formed in a citrated plasma with the help of a platelet replacement, factor 12 activator, and calcium chloride. So the result of the APTT test of the patient is 28 seconds and interpreted as normal.
So the next test ordered is partial thromboplastin time, which is used to assess the amount and function of specific proteins in the blood known as coagulation or clotting factors, which plays a vital role in the blood clot formation. So the principle of this test is that it measures how long it takes for a blood sample to clot after drugs or reagents have been introduced in the patient sample. So the documented patient result is 8 seconds, therefore is interpreted as normal. So for the next test, thrombin time, which measures the time of conversion of fibrinogen into fibrin once thrombin is added. So the principle behind this test is that saturated plasma is given a standardized amount of thrombin and the amount of time it takes for a fibrin clot to form is then measured in seconds. So the patient result is 16 seconds, which is also interpreted as normal. So for the last test ordered, we have bleeding time, which is also a test used to evaluate how a person's blood is clotting. So the principle behind this is that it measures the amount of time it takes for bleeding to cease following a normal skin puncture in order to evaluate the blood's capacity to clot. So the patient has a result of 23 minutes, which is interpreted as markedly increased. Since it is interpreted as markedly increased, blood artery dysfunction could be to blame for prolonged bleeding. So this occurrence could happen when there is a low platelet count, say for example thrombocytopenia, and if there is a platelet aggregation causing a difficulty with platelets clumping together and causing blood to clot.
50 to 400 times 10 raised to 9 liters, or 150,000 to 400,000 milliliter. Since the value for her test result is 41,000, which is beyond low than the normal range, it is valued as markedly decreased. Low platelet counts can lead to internal bleeding of the brain or intestines, which can be severe if left untreated. In the worst case scenarios, this might potentially be fatal. In her case, having a family history of thrombocytopenia could be the reason for having such a low platelet count, meaning she has a severe thrombocytopenia. APTT, protothrombin time, and thromboplastin time are all beyond the normal values, which means the patient doesn't have any coagulation deficiencies. Since bleeding time is markedly increased, Blood artery dysfunction could be to blame for prolonged bleeding. This occurrence could happen when there is a low platelet count. Thrombocytopenia is an example, and if there is a platelet aggregation, it causes difficulty of platelets to clump together and to cause a blood to clot.
Based on the information provided, the patient's symptoms and laboratory results suggest a potential diagnosis of Bernard-Soulier syndrome. First is we talk about the symptoms. The patient presents with continuous bleeding after dental procedures, significant monthly bleeding or epistasis, petechia, and bruises. These symptoms align with the typical clinical manifestations of Bernard-Soulier syndrome, which is characterized by a tendency to bleed, including mucocutaneous bleeding such as nosebleeds and the presence of petechia and bruises. Next is for the family history. The patient discloses a family history of thrombocytopenia, which is relevant as Bernard-Soulier syndrome or BSS is an inherited disorder. BSS is often transmitted in an autosomal recessive manner, meaning unaffected individual typically has two copies of the abnormal gene, one inherited from each parent. A positive family history of thrombocytopenia further raises suspicion for an inherited condition like BSS. So as you can see here, for the test results, we have a decreased platelet count, a decreased bleeding time, and a normal result for APTT, PTT, and thrombin time. So first, we discussed the decreased platelet count. So for the decreased platelet count, the markedly decreased platelet count observed in the patient is consistent with BSS. Bernard-Soulier syndrome is characterized by low platelet counts or thrombocytopenia due to the presence of abnormality large platelets that have impaired function. Next is for the decreased bleeding time. The significantly decreased bleeding time further supports or suggests the possibility of BSS. Well, in BSS, the primary hemostasis process, which involves platelet adhesion and aggregation to form a stable clot, is impaired. This can lead to a prolonged bleeding time. Lastly is for the normal APTT, PT, and thrombin time. The normal results for APTT, PTT, and thrombin time indicate that the patient's clotting factors and thrombin generation are within the expected range. This suggests that the bleeding disorder is likely related to a platelet function rather than a coagulation factor deficiency.
Based on the patient history and the results of multiple laboratory tests, which includes low platelet count, prolonged bleeding time, normal results in APTT, PTT, and TT tests, the results correlates to a genetic disorder called Bernard-Soulier syndrome. This was also supported with a family history of thrombocytopenia. A patient's history, medical conditions, and medications are essential part due to all the valuable information that can help a medical technologist determine which laboratory tests are most likely to be helpful. Medtechs can help to ensure that the patient receives the right laboratory tests by taking the time to gather a complete patient history and consider all of the relevant factors. This can lead to a better patient outcomes and improved quality of life. This slide contains our references for our case analysis. This is the end of our presentation. Thank you for listening and have a great day.